So if you need to wear glasses and you don't wear it for a very long time, the brain tells your body that the way you are seen as the blurred vision, that is the norm. Okay. So we've had people who come in for eye test, and even when you're introducing the lenses, they don't accept. It doesn't improve their vision because the brain has gotten used to a particular way of seeing, especially in children who have to wear glasses. A lot of parents like, I don't want my child to wear glasses. I don't want my child to wear glasses. Okay. But the child grows up and the eye becomes lazy.
Okay.
The child will get to GHS, SHS, and now they can't read from the board. You are trying to help the child with glasses and it's not accepting it. Okay. In the same way, if you have to wear glasses and you are on and off, the brain chooses one and it always chooses the blurred one because you are without the glasses most of the time. So now the brain accepts it as the norm. So it will get to a point that when you wear the glasses, you don't see any difference.
Wow.
So choose the one that you wore.
This one there is a direct one to me. Well. Okay, so does it mean that the moment you start wearing glasses, you're going to be wearing glasses forever?
That's another good question. People ask, oh, so either I'm going to wear it for 1 year and then I'll put it down. Like I explained earlier about short-sightedness, that the image is formed in front of the retina. Your eyeball itself is made that way. And so the light entering your eye, it goes through the refraction, but the image doesn't reach the retina. That is your eyeball. You get it. Just like how some people are fair, some are dark, some are tall, some are short. That is how you were made. You get it. You cannot say that, oh, I've been boarding airplane to America so often that I don't even need to board plane. I can just get there. Do you understand? You get it. So your eye needs that help. If you want to see clearly, you always have to wear the lenses. Recently, a gentleman called me. I was like, oh, he's having blurry and double vision in one eye. And I said, okay, he's almost 30 years, never worn glasses. I said, okay, come and let's check. And when he can realize that he had one of the eye conditions called astigmatism. So typically he asks, so doc, am I going to wear it every day or on some days? I said, do you want to see the world clearly always? He said, yes. I said, okay, then you have to choose it. If you want the double vision to stop, if you want the blurred vision to stop, you have help. Get the help. So if you have to wear glasses, should I say unfortunately or fortunately, it is likely that you would wear it every day for a very long time, almost all of your life. Okay. Sometimes people have very, very small refractive error that is almost negligible. A few people have that they can even do without their glasses. Yes, a few people. But most of the time, if you are myope, you are that short-sightedness or long-sightedness, you need your glasses. There's another one that is age-related. We can't run away from it. Which one is? It's called presbyopia. Presbyopia. Not Presbyterians matter.
Okay.
Presbyopia is age-related. So you realize that most people, when you are 40 years or a little above 40 going, your ability to do near work, reading, threading the needle, now you'll be calling the children
to come and help.
Come and help me. You go to the pharmacy, you take the drug and you are pushing it back. You are putting studies like you need more lights.
Mm-hmm.
This one is the age that has caused this.
Okay.
You can't run away from it. So at that point, it means you need reading glasses the rest of your life if you want to read comfortably and clearly.
Wow.
So one way or the other,
we need it.
We all get this one day. I'm really dreading it myself.
Wow. So, Doc, I want to ask again, in our profession, how can we maintain the eye health?
Okay. So, Hubtel, reduce the bump, reduce the kinky. You know, but when you eat it, it can take you through the day.
It's true, and it's affordable. Just one bowl.
Let's try. Okay. Let's be that cafe and start by taking. Let's order some salad. Okay, so let's eat healthy. Okay, let's exercise. Okay, healthy living. Let's put the phone away before we go to bed. And let's not rush to the phone. Let's practice the 20-20 rule as well. And if you have any challenge with your vision, please visit the eye clinic. Okay, don't go to the washroom, wash your face more. Then they come your first ever. Okay, so visit the eye clinic frequently, at least once a year, once every 2 years.
Can we afford it?
Ways to feel any symptom.
Can we afford it?
Oh, you can. See, the eye is the window to the soul. Close your eyes. You close your eyes. How you open? You see how you're in a hurry to see.
Yes.
So imagine not being able to see. So if it will cost you a little bit to see well, first reduce the data buying and save something to get something to help protect your eyes.
Okay. And you're saying it's not so expensive, but is it really accessible to everyone? Eye care.
It is now in Accra, Kumasi, okay, but it's a bit of a challenge when you go to the other remote areas. Sometimes even when doctors are posted there, some of them do not want to go because of the system. Sometimes you can go and they don't even have one equipment there. Even sometimes the accommodation they give you is not the best. So most doctors are not encouraged to go to those places. So you find out that Accra is getting a bit choked with a lot of eye clinics and all that. So we are hoping that the remote areas, the government hospital will get well equipped so that it also encourage the eye care professionals to also go there to work.
Okay, so Doc, growing up, there's this thing that happens usually when you say, oh, my eye is paining me. Okay, either they'll give you para or they'll say, koto eye drop, bra. What do you, is it an effective thing to do? Is it advisable?
Well, it is not. Okay, you go to the pharmacy and no examination is done. You just tell them your symptom and then they just, take this and go. But that's not how you prescribe medication. You have to examine the person, take an extensive history. It's very important. History taken in examination.
Okay.
If you take good history, you'll be able to solve most conditions, not just eye care, any health condition. Good history taken is very important. And that will lead you to the kind of examination the person needs. And from the results, you can walk in a pharmacy with red eye. It could be bacterial. It could be viral. You get it. But they say, red eye, so take. You go and put it on your eye and it will not be going.
Okay.
Then when it gets worse, then we are the ones going to suffer.
Okay, if that's the case, why is it sold over the counter?
So medications like TS Natural. But have you noticed something in Ghana here? Some of the drugs that are not even over the counter, they do sell it over the counter, unfortunately.
And whose job is that?
I've had a patient travel to the UK. She's a glaucoma patient. So she gets to UK. She didn't know she was going to stay for that long. But for some reason, she has to stay for a very long time. So she needed her glaucoma medication. She went into a pharmacy and they would not dispense without a prescription. She had to get them to send me an email for me to respond before they gave. And even after that, they referred her to an eye doctor in the UK to continue her treatment. But unfortunately here, even antibiotics abroad, you cannot walk into a pharmacy and buy antibiotics without a prescription. But Nana, our beloved country,
We are in crisis.
it shall be well.
So, Doc, you mentioned glaucoma and you mentioned there are no symptoms at all. That's dangerous. So
It is very,
very,
very scary.
So how do we tackle that?
Okay, so we will look at glaucoma. But before I talk more about glaucoma, let's take a look at this video.
Hey, are you blind? Brother, didn't you see those people you've been hitting with the right side of your car? You're hearing on the road again.
Did I hit anyone?
It seems you have tunnel vision. Have you heard about an eye condition called glaucoma?
No.
Glaucoma is a silent thief of sight. It's the leading cause of irreversible blindness worldwide.
As of 2020,
1 out of every 100 people worldwide had glaucoma. This number is expected to increase to 1 out of every 72 by 2040. This condition starts gradually and leads to irreversible blindness of eye if care is not sought early. Often glaucoma has no symptoms when it starts, but as the years go by, it gets worse. You may notice that you bump into things around the extreme of your vision. It can happen to children, adults, and the elderly as well. Considering that glaucoma is a cause of irreversible blindness, it is important for everyone to see an eye doctor for screening at least once a year. Glaucoma could be hereditary. So if you have a family member who went blind suddenly or has been diagnosed with glaucoma, it is important to see an eye care professional as soon as possible. An early eye check helps to start treatment on time, reduces occurrence of road traffic or home accident, delays progression to blindness, preserves vision, and enables one to actualize one's dreams. Remember, it's your vision. Hold on to it by seeing an eye care professional today.
It's very interesting in the sense that there is an eye condition that starts without symptoms,
Why is that?
and its defects is not reversible. It starts without symptoms. That's why it's called the silent thief of sight. It is stealing from you quietly.
Dangerous.
It's very dangerous. Okay. So glaucoma is a progressive, irreversible optic nerve. Optic nerve is what we saw earlier
Okay.
here. When the nerves all gather here, those are the optic nerve here. Eventually, it leads to blindness, aka the silent thief of sight. It is the second leading cause of blindness globally. And then, sorry,
What's the first?
cataracts. But that one is reversible. Okay. I showed you the cataracts here. So that one, the surgery can be done where you take out the natural lens and put an artificial one, the vision is destroyed. But with glaucoma, it is the optical nerves that are destroyed. Okay. We will get into more of that. Okay. The prevalence of glaucoma. Okay. I've already scared you enough. So
Yes.
So we will move on. Okay. Now some of the risk factors. Before risk factors, glaucoma has no known cause. It's not like malaria that they will say, oh, mosquitoes have been biting you, so you have malaria.
Okay.
But it has no known cause. As for that one, the white people, they haven't been able to find it.
Is it that they are not?
They are searching power, but
Wow.
they haven't been able to find out why. Some of the risk factors is high intraocular pressure. I explained earlier that there are some fluids in the eyeball that keeps the eye in shape. So this fluid is constantly being produced and it's supposed to have a drainage system that's it's circulating. Okay. If there's too much production or poor drainage system, the fluid builds up in the eyeball, putting pressure on the ball. It's just like having a balloon and you are pouring more water, it builds up pressure and eventually it may even exactly. Or take a Coca-Cola bottle or any bottle at all, and then put a lot of straws in it. Take it to a tap and let the tap run, filling it. Eventually, what will happen to the straws?
Yeah.
The straws will start
Popping out.
coming out of. So the straws represent the optic nerves that we saw. Okay. We would continue with that. But some of the risk factors of glaucoma is a high intraocular pressure. So that's the pressure that I just explained. Okay. And then age above 40. Above 40, God help us.
They say life begins at 40.
And then
Which kind of life?
After 40, you have to go and do general checkup. After 40, God will help us.
Amen.
And then African. Not again. What are we done? The mere fact that we Africans, we already exposed. And if there is family history of glaucoma, there are times when you are taking histories of patients, you can ask, do you remember of any grandparent or great-grandparent who went blind at some point? We are beginning to believe that in the past, people went blind that we couldn't explain, and we attributed it to age. Oh, the person just grew up and then just went blind. But now we are suspecting that it could have been glaucoma. So the moment you mentioned that, oh, my grandfather's mentioned that the father went blind before, we want to investigate and make sure that it's not running through the family. Okay. And some refractive errors like myopia and then hyperopia, short-sightedness and long-sightedness. We also have long use of steroids. Okay. It can also increase the eye pressures in the eye. That will cause damage to the optic nerve. Almighty hypertension, and they are everywhere. And it's like they are brothers too.
Yeah.
One shows up and the other one
follows.
will come. Then some heart diseases as well. How do we diagnose glaucoma? Through a comprehensive eye examination. So like I said, if you go to an eye clinic, don't go just to get glasses and then leave. Even if your eye care practitioner only looks at refraction, tell them, I want him to look into my eye to see if everything is fine.
Can you request this at any age?
Yes, and that is why it is important that you go to the right eye clinic. Okay? There are people now on social media selling frames, and now they say they're also doing eye testing. And because it's like they have reduced the price, so everybody wants to go to them, risking your vision at some point. Okay. So fundoscopy. Sometimes when you visit the eye, we have this light we shine into your eye. I'm looking through your pupil to look at the back of your eye. There are signs that I can see to suggest different things. So then I'll request for something like visual field analysis or OCT or measure your IOP. All these things have to be done. Okay. Now, like I said, glaucoma is not curable. If you have malaria, you can go and take Coartem and all those things. If you have headache, you take para and it's gone. If you have Apollo or conjunctivitis, we can give you eye drops. It will heal. If you have cataract, surgery can be done. You can see. But glaucoma is not curable. We can't treat glaucoma because we don't know the cause. What causes glaucoma? You get it?
Yeah.
So we can only manage glaucoma. Okay. Yes. So one of the things, the reason why we can't cure glaucoma is that these optic nerves that we are talking about here, because they are connected to the brain, okay, these optic nerves, the cells do not regenerate. Okay. I don't know whether you've heard that brain cells don't regenerate. Once it's gone, it's gone. The same with the optic nerves. So if the optic nerve that is responsible to send messages to the brain have been damaged, no information is being sent to the brain. So you can't see. You get it. So the damage is to the optic nerve. And because they don't regenerate,
That's the end of
that's it. That's why we can't cure it. We can't give you eye drops to grow the optic nerve back. We can't do surgery and put artificial optic nerves there.
Wow.
Okay. In as much as we don't want to scare people, sometimes we may have to, because it is sad. People will come at the last stage that they've lost so much vision, and to break the news that there is nothing I can do about it, it's heartbreaking.
Yeah.
You get it? Eye examinations are not painful. It doesn't take too long. Okay? So whether you feel any symptom or not, just once a year, visit an eye care center and then check your eye, especially if you know that there's family history. Okay, don't, because most of the time, glaucoma, when you dig, they will mention, oh, my mother's side or my father's side. How is glaucoma managed? With eye drops. So it means that the rest of your life, you would be on eye drop. The eye drop is managing the pressure in the eye, because when the pressure builds up, it begins to kill the optic nerves, the cells that form the optic nerves.
Is it the same ones they sell at the pharmacies?
The eye drops. They do sell at the pharmacy, but you need for it to be dispensed, to be prescribed by your eye care practitioner. And there are different types of glaucoma, okay? And there are different types of medications. And sometimes we may start you on one medication, but it will not do the trick. We may have to switch to something else. Or sometimes you may even have to double or triple the medications for you. Now, over the time, you realize that it has become very difficult for people to stay consistent with eye drops. I always tell them that put it by your bedside. If it is twice a day, the first thing is when you wake up, you drop it. The last thing before you go to bed. But they say ento wada. To me sitting here, I would think that is easy. But when it happens, have you ever finished an eye drop before? You've never finished. The moment the sentence, you stop, you see. But I don't blame people too much in the sense that you are telling me, and the glaucoma drugs are quite expensive. You are telling me I'm going to be on this medication the rest of my life, but I am not going to see improvement.
And it's expensive.
And it's expensive. And the bottle is, normally the eye drops have 5 mil, but some glaucoma drops are 2.5 mils.
Wow.
So you can imagine. And it is something that a lot of glaucoma patients find it difficult to understand and accept that this particular condition is not curable. Yes, I'm putting you on a medication, but it's not going to restore what you have lost. What it's going to do is to prevent it from getting worse. So if you come in and then the glaucoma, you've lost some vision, it normally starts from the peripheral vision. So for instance, if you're looking at a big billboard, you will not be able to see the edges. Okay, you can see, even if you're watching TV, that's how glaucoma starts. There's a video that would show that it starts closing in gradually. Then the vision is gone. Okay. But the good thing is that you don't have to wait for it to get there.
Okay.
Through the routine visits, if it is there, we can tell that it is there. And we start managing it very early so that we don't lose any vision at all. Some patients who are not very consistent with the medication and can't afford the surgery, we advise them to go for the surgery. So that with that, they don't have to be on the medication. At least with the surgery, it will keep them for some time without having to put. But even with that, you have to be very, your reviews, you always have to make sure that you go for a review. You'll be checking the eye pressures every time to make sure that we are good. Because nobody knows when the eye pressures would go up again.
Okay. So with the surgery, is this like at the very early stage when you see it?
So it depends. It depends on their eye pressure. Some people will come and their pressures are... In the past, we used to say that eye pressure should be between 10 and 21 mmHg. Okay. But we are beginning to notice something, that we've had people that they are within that range, but there's still a damage to the optic nerve. Meaning that my eye pressure may be 16, which is within the normal range, but for my body or for my eye, that eye pressure is still high for me.
Okay.
It's called normal tension glaucoma. So there's a damage still ongoing in the eye. Okay. So the long and short of this whole thing is, get your eye tested. Don't wait to feel any symptom.
Okay. So Doc, you mentioned glaucoma is not curable from did I say the scientific, I don't know,
The research.
yes, but local champions, the traditional medicine, is there anything?
It's a very good question, because people have gone out there and believed that some herbalists claim they can help with glaucoma. What we are saying is that your optical nerves are dead. Okay. And no medication can resurrect them. So if somebody tells you that taking herbal medication will help with glaucoma, I'm sorry. They will end up damaging you. I've had too many people come to my consulting room in tears because they paid so much money to these people in the name of... I remember one mama said, when they get there, they line them up and the doctor will come and put eye drops, and then there'll be a lot of tears and discharge. The person said, aha, you're really in. It's sad. It's sad. And so sometimes we, the eye care professionals, we organize free eye screenings. In fact, for my facilities, we do a lot of free eye screening for schools, for companies, for corporate organizations. You don't pay. Let me just screen you for free so that if there is an issue, you can take it up and then work on it. Okay.
This is quite scary.
Oh, yes, you have to be scared. If I don't scare you, you will not do it. You see, I always tell people that it is good that you know and seek help. Better than you are just there in your 50s, in your 60s. You wake up one day and like, let me wash my face. Still,
It's not working.
and that's what we've been seeing.
Yeah.
And to know that if I had checked earlier,
It would have been prevented.
and mind you, what has been lost cannot be reversed.
Wow. Doc.
So as a corporate organization, I would suggest as part of your health screening, you incorporate eye screening so that if even the staff will not walk into an eye, at least you bring eye cleaning to them. And then when we see something, this is what we are seeing. You want you to take a step further and check. If it is glaucoma, praise the Lord, because now we can manage it early. If it is not, praise the Lord.
Good.
And not just glaucoma, so many other eye conditions can be detected earlier. So many of them.
Okay.
Yes.
Okay. All right, Doc. I have one last question.
Okay.
In the earlier slides, you mentioned smoking. I want to know, these days we have people doing said vape and all of those things. Are these parts of the smoking, or are you looking at just cigarettes?
Or smoking.
All smoking with smoking. Okay.
The vapor.
All vape. Okay.
That even the manufacturer has put a caution on them. Yet you want to take it.
Okay.
Yes, please.
Doc, there are times after working for a while, I'm like, my eyes are itchy. And I think I hear that from some of my colleagues.
Okay.
What would you say causes that?
Okay. So itchy eyes are very common. In fact, it's one of the common symptoms that a lot of people walk into the eye clinics with.
Okay.
There are different forms. We call it allergic conjunctivitis. Okay. Conjunctivitis is inflammation of the conjunctiva. It's a layer that covers the white parts of the eye. So when it gets inflamed, so conjunctivitis. Okay. So itchy eyes are normally caused by certain reactions that we have to certain things. It could be some spices, sometimes even perfumes.
Okay.
Sometimes even detergent, what you use to wash your bed sheet or your clothes. And for the women, some brand of makeups
Okay.
can cause itchy eye. But for people who use a computer a lot, sometimes it's not that their eyes are itching, but because the long period behind the PC causes dry eye, you feel as if there's something going on it. And to you, you think the eye is itching, but there are dry patches. I think I should have mentioned this earlier. You know, when you are on your PC, there's a study that when children are playing a video game, okay, normally you should blink like 50 or 60 times per second. Normally, if you're not doing anything, okay, in a minute, sorry. But when you are on your PC playing a game or working, you are so into the work that you're doing that the number of blinks reduces, okay? And it is this blinking that helps the tears that are being produced to spread on the eye evenly to avoid dryness. So if the number of blinks reduces, there will be dry patches on the eye and it makes it feel uncomfortable. So you find people who use a computer a lot or screens a lot, they're always like trying to rub their eye as if something is there, but it is dry eyes. But some too may genuinely have allergic conjunctivitis. They may be reacting to something. So with allergic conjunctivitis, we can give medication to treat it. But because it is something you are reacting to, after the treatment, when you get into contact with it again, the reaction will come back. So we ask patients to try and study the things around them, the foods they eat. So maybe if you ate, let's say, granite soup today, and by the following day you have a lot of it, you could be, maybe could it be the granite? So you can hold on with granules and eat another time and see the reaction. That's is granules or certain makeups or facial cleansers. So many things, spices in food. Okay. So you start eliminating the things gradually. If you're able to find it, that will be the solution.
Okay.
If not, we will treat. But once you get into contact with it, it will come down. But for children, normally children, they have this a lot. About 80% of children who come to the eye clinic have allergic conjunctivitis because they are still young. Okay, so their immune system is a bit still like weak. But as they grow out of it. So you realize that by age 13, 14, 15, 16, it ceases. Yes.
So is there any immediate thing we can do?
So we have what we call artificial tears or tear supplement. We recommend it. We prescribe it a lot for people who use the computer a lot. Apart from the screen protective glasses, you can have artificial tears natural, cool eyes, the assist tear, all those tear supplements in your bag or by your desk.
Okay.
Every 2-3 hours, you can just drop. It has no side effects. It's just a tear supplement to help lubricate your eye for more comfort.
Okay. Before we go, do you have any final words for us?
My final word for you, my dear Ethel.
Yes.
The greens, no. Try. And to everybody listening to us, it doesn't take too much to get your eyes screened. It may take a lot to get cured or managed. Okay. So walk into an eye care center. Okay. And ask that you just want your eye to be screened. Get your eye screened at least once or every 2 years. Okay. So that if there is an issue, we can manage it. If there is no issue, we thank God for it. Don't ignore regular eye screening. Thank you.
Thank you all for tuning in. I have learned a lot. I hope you've learned something too, and maybe you're a little scared. So please share this with someone, take an action, and let's continue to see each other very well. Bye.